everyone. Thank you for watching the lab safety video. So during this lab, we're going to be dealing with a number of medical hazards, the same sorts of medical hazards that you deal with in an actual medical environment. The main one we're going to be working with in this lab is blood, although there can be other hazards that will come up. And so I want to talk a little bit about how to deal with those hazards. Now, the first and most important thing is you're in this class is that the health of your patient is more important than anything you are doing for this class. Same with your health. So if there is any activity in this class that is counterindicated for your patient, that could be dangerous for your patient for any reason, don't do it. Well, if you can find another patient to work with, that's great. If you can do it on yourself, that's great. If none of those options work for you, reach out to your instructor and they will work out some alternative. So please take your patient's health first. Now, in doing that, you're always going to explain to your patient what you are doing before you do it. So this is Grant. Grant is going to be our demo student and demo patient today. I'm not actually going to take Grant's blood, but if I were going to say, hi Grant, for the experiment that we're doing today, I'm going to take this lancet and prick your finger to take your blood. Is that okay?
Yes, absolutely.
All right. We're not going to do that because I don't actually need Grant's blood for anything right now. But that I want you to be thinking about that every time. Check with your patient on what's okay. So if you're going to be touching your patient in any way, make sure that your hands are washed well beforehand. And if you're going to be handling blood or anything that's going to go into your patient's mouth or any other orifice, you should also be wearing gloves. So the first thing that I want to demonstrate here is how to deal with gloves. So Grant, would you go ahead and put on a pair of gloves for me?
Absolutely.
Thank you. So these can be whatever disposable gloves are convenient to you. Here we're using nitrile gloves. The standard latex or nitrile gloves that you'll find in any pharmacy will work just fine for this at home. But now let's say that you've been handling blood or something that's been in someone's mouth, and now you need to take these gloves off safely in a way that's going to avoid contamination for the environment around you, and most importantly, avoid contamination for you. Now, before you do any experiment like this, you need to have a place to dispose of these gloves and anything else that you've used. So if you are using a lancet or any other sharps, so when we do the blood glucose experiment, you'll be using automatic lancets, kind of like this. And for that, you'll need a sharps container of some sort. Now here I have an official biohazard sharps container. You can buy these at any pharmacy. If you have someone in your house who's diabetic or uses any other injectable medication, you probably have one of these in your house already. If you do not, you can buy one, or you can just get any plastic sealing container, like a juice bottle or a soda bottle will actually work just fine for this. Now, if you are in Illinois, you are technically allowed to, at the end of this course, seal that up well with tape and throw it away in the normal trash. If you can, I would strongly encourage you to take it to a site that accepts these back. Many pharmacies do, all hospitals do. There are lots of places to take this back to. If you are not in Illinois, please look up the local regulations. In some states, you are required to return it to a site. So please don't assume that it's okay to throw it in the trash in your state if you don't know the answers. So the other thing you'll need to have is some sort of sealing plastic bag to put gloves or wipes, anything that you've used to handle blood into before you throw it in the trash. So in this case, we have a biohazard bag here, which in the lab will get autoclaved and thrown away after that. You in your home don't actually need to autoclave it. Think about it. If you got a cut on your hand and wiped it up with tissue paper, you're not going to autoclave that in your house. However, you should take a sealing plastic bag and put those things into the sealed plastic bag and then close it up afterwards. So now we're going to go over how to remove these gloves safely. So let's assume for a moment Grant has been doing something. These gloves may have been contaminated, and we want to remove these in a way that is not going to expose Grant to any of these hazards that we've been handling. So the first thing you're going to do is you're going to take the gloved finger of one hand and grab the bottom of the cuff of the other hand and peel that glove up so it is mostly off, but it is still, you still have some on your fingers. So you can sort of go so you can get the inside of the glove exposed. So yep, keep going just a little further. And you've still, now you've got, yep. So now you can come in and use your gloved fingers. So you can take your thumb of that hand that still has the glove on it, put it under the cuff of the other hand. So under that cuff, and grab the outside with the still gloved fingers. And then peel that whole thing off, protecting your fingers with that remaining glove, and then pull that whole thing off. So now all the out parts that were outside are on the inside, and nothing that was ever on the outside has touched your skin. So then those gloves can go right into the trash. If you are wearing gloves that are too tight, you may find that you have trouble with this. If you're having a lot of trouble with this, try going up a size in gloves. That is a common issue that we run into. At the end of that, we would seal up this bag. Right now, this will continue to be used. So that's the basics. That's most of the hazards we're dealing with. This isn't a super high hazard lab, but again, most important things are your safety and your patient's safety. So please don't take any risks with that for the class. If you have any concerns, you can always reach out to your instructor and talk to your patient and make sure that what you're doing is okay for them. Thank you for watching. And thank you very much to my helper here, Grant.